Hello everyone, welcome back to my channel. If you're new here, my name is Erin. I am a fourth year urology resident and I do videos on this channel, but I also have a TikTok that I do videos on. And over the past couple months, I've gotten some questions that I thought might be interesting for me to answer. I really enjoy doing this. This is like the whole reason I wanted to be on media. And so I thought this would be fun. If you have any questions, please comment them below. I'd love to do another one of these videos. Let's jump in. So the first question is, do residents introduce themselves and brief the patient before surgery, or does your attending do it and you just do the surgery? And this is a really good question, and I think it really depends, like hospital-wise and situation-wise. So a lot of the times, if it is a consult and you decide that that consult needs to go to the operating room, you will meet the patient first before the attending does, make that decision, staff with your attending. If they agree, you go back, you consent the patient, you kind of tell them about the surgery, tell them the risks and benefits, brief them on the surgery. And then before they ultimately get wheeled to the operating room, your attending also meets them and answers any questions and kind of goes over everything. But you are kind of the first point of contact with that person. So you kind of lead the show in that situation. In situations where the patient comes from clinic or from an outpatient setting where the attending has already met them, they've already talked to them in clinic about the surgery, that you weren't necessarily there in clinic, it was their personal clinic and you weren't there, they've already briefed them, they know them, they've maybe been following them for years and have decided they need surgery, then usually the attending's the point of contact. They kind of brief them, they'll do the consent. We meet them before surgery if we're in that case and obviously go back and help with the case, but the attending is kind of the main point of contact in that case. So it really, really depends. Certain times, even with patients that attendings have met before and they're outpatients, the attending will go over the surgery and then we do the actual consent preoperatively. It really just depends. But that is how I have found in my program, the biggest differences between inpatient consults going to surgery and then outpatient clinics going to surgery from there. The next question is, how bad is urology residency? Sleep, life, etc. This is also, I think, a really good question. This also really depends. I would say sometimes it can be quite hard and quite rough for us, and I think for a lot of other programs in the US. Second year is notoriously a very hard year. It's the year where you see most of the consults, carry the consult pager, you're operating, in my program, you're operating and doing that between cases. You're pretty busy in the OR because you're doing a lot of more small cystoscopy cases. So there's 5 of them in a day and you're going between cases and running to see consults and you take a lot of call. And so those days can be pretty rough in terms of work and sometimes call nights can be rough. So it can definitely be hard, but I wouldn't say that is the case for the entire residency. You get time to relax, you get weekends off, you get vacations, you get it is maybe not quite a 9 to 5, but it is very doable. It's just that I think it does go in waves. I think some years are harder than others. I am in a pretty easy year right now where I had 2 months of research. I had 4 months at a hospital that I was on call 1 night a week and 0 weekends. Right now I'm on call every 4 days and 4 weekends. And then next block, I'm kind of on a harder rotation where I am on call more often, but this is our easiest year. And I've had time to live my life, kind of function as a normal person. So it, again, really depends, but I wouldn't let the fear of something like a residency being too hard keep you from doing that residency, because I think every residency is hard, especially when you compare yourself to maybe your friends who are doing more classic 9 to 5 jobs. And I will have to say, my husband, who is not in medicine, who works a more corporate job, works just as hard, if not harder than I do. So it's not just medicine that's really hard, and it's definitely worth it. The next question is, as a young female, how do you deal with and relate to men? This I thought was an interesting question. So first I just want to address, urology is not just male surgery. We see a lot of women and we operate on a lot of women, and there are even specific female urologists. We do kidney cancer, women have kidney cancer, we do bladder cancer, women have bladder cancer, kidney stones, all of these things. There are specific parts in urology, a lot of urology has to do with the prostate, and obviously women don't have prostates. So we do see a lot of men in that case, like erectile dysfunction, a lot more male sexual health than female sexual health. I think women go more to their OBGYNs for that and males come to us. But we do see females. But, you know, I think I have no problem relating to patients. I think just being generally empathetic and, you know, explaining everything in very understandable, open terms. Most men are willing to talk to me. They don't, you know, clam up. Like, they understand that I am a physician and I'm just there to try and help them get the healthcare they need. I have had multiple situations, that being said, where some men have refused to talk to me, and I don't know if it was because I was a resident or a woman. And it happens, and you just kind of get over it and just know that, you know, no matter what, like when I'm in practice, those patients probably won't come to me. That's fine. I'll have other patients that would love to come and see me. So you do get that, but I find it's more rare than I thought, and it doesn't impede my ability to do my job at all. The next question is, what is the average length of these surgeries? This was replying to a video that I did about the types, like what my week looks like or what my day looks like and the types of surgeries that I do. So she was asking, you know, is it 2 hours or is this actually like the actual 4 or 5 hour block? Again, this really depends. Urology, I think, is one of the great specialties because we have a whole range of surgeries that we do. We do really quick 5-minute flexible cystoscopies where we just look in the bladder, we see if there's any tumors or any abnormalities. If there's not, great, we're done. It's 5 minutes and it's like a diagnostic procedure and it's a surgery. Then we also have these like 8 to 12 hour cystectomies where you take out a bladder, you reposition part of their bowel, you plug in the ureters to the bowel so that it's a conduit for the urine. And that's obviously a more in-depth and long surgery. So we have kind of the whole gambit of surgeries. We can do endoscopic surgery, we can do robotic surgery. And I really think, and I've done a video of this on this before, but like that's one of the reasons I really like urology is there's kind of any possible thing that you could do. I would say kind of for the surgeries she's referring to, the prostates and the nephrectomies, it usually does take about 3 to 4 hours. And that's between kind of getting access. So a lot of these things we do robotically. And so we get access with the robot. That means putting in ports in the abdomen, making small little laparoscopic incisions and adding ports through which the robot works. So we know we have to do that. We take a look around, we insufflate, you know, we position the patient. We kind of get all of our arms in the robot, set up the robot, and then start the robotic portion of the surgery. The robotic portion of the surgery takes, you know, usually 2 to 3 hours, could be more, could be less, really depending, but like 2 to 4 hours maybe. And then you have to extract the specimen, close the patient. So you have to close the fascia, which is kind of the strength layer, and make sure they don't get any hernias, and then close the skin, and then the patient wakes up. So I would say usually more on the 4 to 5 hour end in terms of those bigger robotic surgeries. But you know, that being said, you have some people who are very fast and this is all they do, and they can get it done in 2 hours, and it's truly a joy to watch them operate. So the next question is, what are the most competitive specialties? And I wanted to give you guys a real answer. So I looked up and I found an article from the American Medical Association from 2018. And then I found kind of a more recent article that integrated a lot of different sources. And this was kind of the consensus. So according to these two places, orthopedic surgery, plastic surgery, radiation oncology, neurosurgery, ENT, so otolaryngology, thoracic surgery, vascular surgery, interventional radiology, and med-peds, which is a combined medicine and pediatric residency, were the most competitive specialties, which I think makes a lot of sense. Urology is not on there. Next question is how to get the most out of conferences as a medical student. I personally did not go to any conferences as a medical student. That being said, I think as a medical student, you know, just if you're not sure on your specialty and you have the opportunity to go to a conference where you can kind of explore a specialty, explore what they have to offer, I think that's really useful. Just kind of meeting other people in that specialty, seeing if you vibe with them, seeing if you are interested in the topics, the research, like if that's what you're interested in, seeing if that's something you want to do, seeing if, you know, you like the surgeries, if you like kind of what they're discussing, what seems to really excite those people. I think that's a good thing to kind of pick out at conferences. If you're pretty set on a specialty and you're kind of going to a conference that you eventually want to do, I think networking is kind of the most useful thing you can do at a conference, because if you get your name out there and people know you, they'll be more likely to kind of recognize you on the interview trail, be like, oh yeah, I think that person's really good, I've met them before. And I think it does increase your chances of matching. Being a known entity, I think in general, increases your chances of matching at a program where you are known. So I think those are kind of the most useful things to do, but don't stress out about them. As a medical student, you'll have plenty of time to go to conferences and you should just enjoy yourself. The last question is, do you have any real hobbies? I included this as kind of a joke question, but to be honest, for a while, like when I was speaking about earlier, the harder years of residency, not really. I would say I do kind of the bare minimum to keep myself happy and healthy, which is working out, sleeping, and like talking to friends. I would say social media is a hobby. It is something that I really enjoy doing and spend, not an insignificant amount of time doing. Now that I've had more time, I've ordered a needlepoint. I have it. I have not started it, but I'm gonna start it. So needlepointing, I've been really into puzzles. I love to read, and even more so, I love to listen to books on tape. I would say that's kind of the thing in my free time that I've been doing recently. But also, I play squash and tennis, kind of along with the exercise. I do a lot of the Peloton too, but in terms of like fun sports hobbies, I play squash and tennis, and I do the New York mini crossword every day. So those are my hobbies. I hope you guys enjoyed this video. If you did, or you have any questions that you'd like to add and I can do another one, please comment down below. I'll see you guys next time. Bye.